welcome to Learn Easy. Today we are going to learn about mandible, which is an important topic for VIVA. Coming to parts of the mandible, the posterior part of the mandible consists of ramus of mandible. Anterior part consists of body of the mandible. Body of the mandible. See guys, this is the angle of the mandible. It is the angle where the ramus and the body of the mandible meets. This is the middle of the mandible. This is known as symphysis menti. Symphysis menti. You guys may appreciate this protuberance. It is a protuberance and it is a mental protuberance. Mental protuberance. Something that is elevating and that is protruding. So mental protuberance. It is known as mental protuberance. And these are mental tubercles. Nothing but mental tubercles. Then here comes a foramen through which mental nerve passes is mental foramen. See, this is bilateral. Bilateral. Mental foramen is bilateral. Mental foramen. Actually, this mental foramen is at the inferior border at birth. At birth, it is at the inferior border. As the age increases, it moves upwards and it is located below the apices of premolars. Finally, at the adult stage, it will be below the apices of two premolars. Here there is a line passing obliquely, right? This is nothing but oblique ridge. Ridge is nothing but elevated ridge that is passing from posterior to anterior. Most important parts. This is a process. Just a projection or a process. This is known as coronoid process. And here it is condyle. Condyle. It is somewhat head-like, right? Condylar head. This condylar head forms TMJ, temporomandibular joint. This condylar head forms TMJ with temporal bone. This helps the mandible in movements, lateral movements, upward and downward movements. All the movements are due to TMJ. As this condylar head makes a joint with temporal bone, that is nothing but TMJ, temporomandibular joint. And see, on upper border, these are known as alveolar sockets. And the bone here is alveolar bone. Alveolar bone. These sockets consist of teeth. Coming to the internal, there will be 4 tubercles on lingual side of incisors. And these are superior genial tubercles and these are inferior genial tubercles. Here you can find another foramen, right? This is nothing but mandibular foramen. You are seeing mandibular foramen on internal surface, whereas mental foramen on the external surface. Both are bilateral. You can see here, both are bilateral. Mandibular foramen passes mandibular nerve and mental foramen passes mental nerve. Here you are appreciating a line, right? This is nothing but mylohyoid line. Most of the parts and names of this mandible starts with M. If you can appreciate, mylohyoid line, mandibular foramen, mental foramen, right? If you can able to appreciate, fossa is present here. Fossa is nothing but a depression. This fossa is nothing but submandibular fossa. So this fossa is nothing but submandibular fossa. And above the mylohyoid line, this fossa is known as lingual fossa. This submandibular fossa is attached to submandibular gland, which is a salivary gland. So this is the mylohyoid line and this is submandibular fossa, whereas this is sublingual fossa. The submandibular fossa and this is lingual fossa. This is mandibular foramen. This is condylar head. This is a coronoid process. A notch that is present here is mandibular notch. This is a notch like and this is a mandibular notch. As it is present on the mandible and it is a notch, It is known as mandibular knot. Let us once revise quickly. This is a symphysis menti. These are mental tubercles and this is mental protuberance. This is a mental foramen. This is the orbicular line, orbicular ridge. This is ramus of the mandible, body of the mandible, angle of the mandible. Coronoid process, condylar head and condyle. This is the mandibular notch. This is oblique ridge. This is the alveolar bone and this is alveolar socket. Mandibular foramen, mylohyoid line, lingual fossa, submandibular fossa. That's it guys. This is about mandible. Just practice it. You can able to remember it very easily if you practice 1 or 2 times. Thank you. If you like this video, please do like, share, subscribe. Thank you.